Hello, I'm Chloe Hampson, and today we will be discussing lead shielding and external beam radiotherapy. And you're right, Kevin, this is going to be an amazing meeting. So first we're going to watch a short clip or a short portion of this video kind of detailing what is cancer radiotherapy and how does it work.
Radiotherapy has been used to treat cancer for over a century.
But new technology is making it modern and precise. It works by aiming intense bundles of energy at cancer cells, damaging their DNA. If a cancer cell can't repair its damaged DNA, it dies. But the radiation also damages nearby healthy cells. This is what causes side effects in neighboring tissue. Most radiotherapy is given from outside the body, usually using X-rays. And new experimental techniques are improving accuracy.
So carrying on from the video, what is external beam radiotherapy? Well, it's aiming intense bundles of energy at cancer cells to damage their DNA. And most radiation therapy machines right now use photon beams in the form of X-rays. And in the photo shown, you can see a linear accelerator, and that's what the setup would look like if you are a cancer patient receiving X-ray radiotherapy. The downside with using X-rays, however, is that these beams continue through the body and can damage healthy tissues by ionizing atoms and disrupting molecular bonds, hence leading to research in proton therapy, because with protons, once they hit the cancer, they do not carry through the rest of the body, which leads to fewer side effects. Okay, Michael, let me try real quick. Energy bundle hit cancer cell dies, no more cancer. How's that? Well, how do we minimize the risk with X-rays? Well, lead shielding is used to protect vital organs depending on where the patient is receiving treatment. But not every patient has a lead shield. That's only when a vital organ is nearby that needs to be protected. And for X-rays, lead is a particularly effective shield because lead has a high atomic number of 82. But if you're using alpha particles or beta particles or anything else, those will require different materials, so you wouldn't be using lead. And like I said before, with an atomic number of 82, a large number of protons equals a large number of electrons, which equals less radiation received. And density, thickness, atomic number are all important when determining material, which is related to the Compton effect, which is what we will be talking about on the next slide. But this photo is a testicle shield. There's lead inside of there that's surrounded by rubber. Yes, I'm serious. I don't know how it works with the placement on the body, but looking at it, I don't understand. I don't understand when I'm looking at it. Anyways, we'll carry on. So lead does not only reflect the X-rays, but it also absorbs some of it. And so we have to discuss partial absorption, which is not really covered in this class, so I'm going to talk about it before we get into the portion of this class. But the Compton effect is a partial absorption process, which means that the original photon is losing energy, basically. So looking at the photo, you have an incident X-ray going to enter an atom. It's going to bounce off the electrons and fly off as a scattered X-ray, which with a longer wavelength. And the probability is directly proportional to the number of outer shell electrons and the density of the material, hence why we use lead, because it has a lot of electrons. And so the initial X-ray will lose energy, like I said, and have a longer wavelength. So it could be now ultraviolet or anything on the spectrum with a longer wavelength or a lower frequency. So now we're going to talk about the wave number for the lead X-ray interaction, which is what we're going to use to determine the thickness of the lead needed to reflect X-rays. So the wave number K, we're going to use the equation 9.126 from the textbook. And as you can see, that's the equation. K is also equal to 2 pi over lambda, and that's important. I'll talk about that in a second, though. For lead, we're going to use resistivity of 22 times 10 to the negative 8th ohm meters. And for X-rays, we're going to use the frequency of 3.63 times 10 to the 19th hertz. And so that's why we're going to change the equation a little bit to fit our constants that we are using, and you can plug that right into the equation. And when you plug everything in, you're going to get 9.26 times 10 to the 8th 1 over meters, which is K. And the distance needed to decrease or make the wavelength smaller is 1 over K. And that distance needed is 1.08 nanometers, which means that once it hits the lead, it's going to go 1.08 nanometers, and the wavelength is going to be significantly decreased. However, with continuous high energy beams, lead also has to act as the absorber, which is what we talked about on the last slide. All right, glad to know everyone's still listening. So for our conclusion, more than the wave equation is actually used to determine the thickness of lead necessary, because lead does a good job of reflecting X-rays, but in high doses, lead starts to degrade, which is why you also need a bigger thickness and a bigger density, because as it's degrading, there's going to be a significant period of time that patient is sitting under there getting those X-rays, and it's going to degrade, which means you need more of it, which is also the Compton effect, more absorption. You understand. And there's also other factors that are taken into account when actually determining this number of 1.08 nanometers. That's a very, very small amount. But there's also external factors like I just talked about, sitting there, whatever, that go into actually figuring out how thick it needs to be. And they're also looking into doing potential research into ricocheted radiation, because with the Compton effect, we saw that radiation is reflected off and it's going to be bouncing around. So even if you're protecting yourself with the lead, you may be causing more harm than good by the other radiation you're creating in the room. And that is all. All right, we're done, people.